Walter as well. Thank you for sharing, Mike. Walter, thank you so much for being here, and thank you for your willingness to share your story with us.
Good afternoon, Senator. My name is Walter Inostroza. I work for eye care for 25 years, and now I'm COVID positive. I'm supposed to be on vacation, but I'm sick. But anyway, about that letter they said Mike was mentioning, it was dated April 13. I signed the paper, and when I went to ask him for the PPD, because if I sign, I'm supposed to receive that. They say, "Oh, we don't have it," and I said, "Well, you dated like we received it." And oh, that's a mistake. I said, "It's not a mistake. It's a legal paper. We signed it. It's a legal paper." And I signed it on the April 22nd, and the letters was April 13. That means they had the PPE equipment in the closet or somewhere. It should be able to all of us on the day they received it. I don't know why they held it back. And then when they give us the PPE, it was this yellow outfit. It looked like a painter suit. And then this homemade shield, there was 11 by 8, is PVC made. There was a homemade. It doesn't fit the standards for medical equipment. And basically it was homemade because they don't have every item which manufacturer has how to take care of your item, how to dispose of, take care of it, and keep the equipment. That was one. Two, after they give us that with the shield, we were not supposed to switch masks. They said when we go to a COVID patient to take care of him, the shield is supposed to protect the mask, and we don't need the need to keep switching. I don't know where they have a manual for that to use it, because that's what the director nurse told us. That's the standard. I don't know who told her, or it's a letter that it says as a standard by the CDC. And now I'm infected. I got a couple of the friends that I heard they're infected. My nurse Alice is infected, and I mean, now that I'm home, I infect my wife, not knowing. And when I asked earlier for the mask, oh no, we don't need it because they don't have it. They're not tested. But all the people that were turned out to be positive, they got all the signs, but they said, oh, they're not tested. You just continue to do your work that was supposed to. That even before the PPE, it was distributed.
Thank you, Walter. So I'm going to repeat what I heard. So first of all, you were asked to sign a paper on the 23rd or so of April. And at that time, while you were signing, it was predated to 13th, stating that you were getting the PPEs. But even when you signed that paper, you never received the PPE till you have to fight to get the PPE. Is that
right? The following day, we received, I mean, it was not the following day, I was not sure. A couple of days after, we start receiving the PPE. And then they want you to sign when you're receiving the PPE, they want you to sign again. But at that time, I didn't sign that paper because I said I already signed it. But I noticed they black market the dates and the things that they were given to us. It's the same letter. They crossed that date. There was issued. The letter was issued on April 13th. Then they handwrite it and they post it, I think April 22 or April 24, something like that. But I didn't sign the letter. I didn't get a copy of that letter. But the original letter, I did have a copy. I put it in my locker. I said, maybe it would be good for something.
Okay. So, and then the other thing that you have mentioned is that you yourself got infected, and you got infected and you gave the infection to your wife as well, and you got your infection
Yeah,
from your workplace. And
right.
and you were continued to required to be working while you were infected.
Well, I didn't know. I didn't know until last Friday. I was coughing and I called my doctor and I did a video consultation. And when I told my symptoms, they told me, stop working, get out of work, go home, isolate yourself, consider yourself you have it. And we will send you to get tested. And I didn't get tested until Monday. And on Tuesday, I received my results and I was positive. And then following that, my wife came out with a positive too.
So for everybody's benefit, this is a conversation about Fresh River in East Windsor. This is a nursing home in East Windsor where these are the workers of the area, and this is a place where so many of the workers have been infected, and many of the people, the residents of this nursing home have been infected. What we have heard is in the beginning, and even till recently, the people were not getting the PPEs. They were getting actually people to sign papers that were done, and they were predated as if they were receiving PPEs all along, and they were actually having, the people had to buy their own personal protective equipment, the workforce, and they were not getting any support, and they were not getting any recognition of the challenges, and as a result, this disease spread in many of the workers, and then some have been very sick, and some of them have a risk of getting, God forbid, critically ill. And not only that, the residents, the patients who are supposed to be there protected, their protections were not there. And even at this time, they're making decisions to actually keep patients with COVID and non-COVID together in the same place. This is what we are dealing with. We need stronger oversight. We need all hands that can be available to in the state government to start to look at the nursing homes, make sure that they protect the workforce of the nursing homes. They need to make sure that the residents are protected. We need to make sure that the safety net for the people are there. These workers have no rights right now. They do not have any protection right now. They do not have any opportunity. They are as frontline as anyone else is. And for them to not get the same opportunities that are supposed to be for all people is unfair, wrong, unethical. And actually, this is murderous, what is going on. And I'm just going to make sure that everybody hears these stories, because when I tell these individual stories, I get these letters back that their independent assessments have been performed and everything is going like clockwork. And these owners of the nursing homes, the administrations are like heroes, and they are the best thing that ever happened to mankind. These are the kinds of responses that I get when I complain. But I wanted to get these videos out today so that these people are not heroes who are in administration, and they're making choices which are not right choices. And when they're making choices knowingly, that is.
Senator, can I ask Elise one question? Actually, Susie said it too, but Elise, the CARES Act, the Federal CARES Act that came down, or that was passed, that allows for 2 weeks of sick time. Are you getting that while you're out with COVID?
Not at all. They told me that the company has more than 500 employees, so that CARES Act, it does not apply to eye care. And I have to borrow PTO because I don't even have, 80 hours of PTO. So I'm borrowing probably a good 70 hours, and I have to pay that back over time. So I'll be in the negative with them for God knows how long.
Okay, thank you.
I want to thank each and every one of you for sharing your stories with me. I am going to make sure that everybody else gets to hear this as well. Katie, thank you for helping me get all the people together. Ellison, thank you for your help in getting everybody to be able to share the stories. You guys are really doing incredible work under circumstances. If you were to make a parallel, we have actually, if we use the example the president has used, that we are in the state of war. If this is a state of war, we have actually sent our soldiers with nothing, not even a uniform, let alone a gun. This is where we are, and then our soldiers are sick and dying, and the people that they're supposed to protect are dying as well because of the local colonels, majors, generals, whoever these people are. They're making very, very bad choices. And I want to make sure that everybody gets to hear about what they've done. Thank you so much. Thank you for listening, and we'll get this word out to everybody. Thank you.